This CMS National Training Program recorded webinar provides basic information on Medicare, Medicaid, the Children's Health Insurance Program, or CHIP, and the health insurance marketplace. You should always consult the relevant statutes, regulations, and rulings for official legal guidance. This is intended as an informational resource for partners. It isn't meant for press purposes and isn't on the record. If you're a member of the press, you can email press@cms.hhs.gov.
Welcome everyone to today's virtual workshop, Helping with Original Medicare Costs, Medigap. I'm Carrie Watson with the CMS National Training Program, or NTP. So first, let's introduce our team today. So first we have my NTP colleagues, Doria Diaco-Giannis and Leslie Long, who are assisting today with our Q&A box. And you'll be seeing things come from the chat from them with our download link for our slides and our NTP mailbox information. But also we want to really give a warm welcome to our presenters today. We have Derek Claggett and Marie Gutierrez. They are both with the Center for Medicare at CMS, and we are very happy to have them present on today's topic. We also want to send a big thank you to everyone involved and for all of your participation in today's workshop. And this just is a reminder here. I'll leave this up for just a moment, so take a look at that. All right, so with that, I'm going to turn things over to Marie, who's going to kick us off on our Medicare Supplement Insurance Policies presentation.
Great, thanks, Carrie. Hello, everyone. My name is Marie Gutierrez with the Division of Enrollment and Eligibility Policy within the Center for Medicare. And I'm happy to be with you all today and talk about Medigap, along with my colleague and subject matter expert, Derek Claggett, who you'll hear from shortly. So the lessons in this training module will discuss how Medigap policies work with Medicare, what Medigap policies cover, how they're structured, and when to buy a Medigap policy. At the end of this session, you'll know what Medigap policies are. You'll know key Medigap terms, the steps to buying a Medigap policy, the best time to buy a Medigap policy, guaranteed issue rights, and where to get information on Medigap rights and protections. Lesson 1 provides basic information about Medicare and Medigap policies. So we're going to discuss how Medigap works with Medicare and what these policies cover. So at the end of this lesson, you'll be able to explain what Medigap policies are, identify Medicare Part A and Medicare Part B, excuse me, Medicare Part B covered medically necessary services, and find the current Part A and Part B amounts. So when you first enroll in Medicare and during certain times of the year, you can choose how to get your Medicare coverage. There are really two main ways to get Medicare. The first way is through Original Medicare, which includes Part A and Part B. Part A is hospital insurance, and Part B is medical insurance. So with Original Medicare, you can also buy supplemental coverage, so enter Medigap, to help pay your out-of-pocket costs. The second way to get Medicare is through Medicare Advantage, also known as Part C. Part C bundles Part A, Part B, and usually the Part D drug coverage, and it includes some other extra benefits. But to contrast these two ways, Medigap policies does not work with Medicare Advantage. Medigap policies only work with Original Medicare. A Medigap policy is an insurance policy that helps fill gaps in original Medicare and is sold by private companies. Original Medicare pays for much, but not all of the cost for covered healthcare services and supplies. So Medigap can help pay for some of the costs that original Medicare does not cover, like copayments, coinsurance, and deductibles. Medigap policies are standardized. So, and in most states, they're named by letters. So you would hear them as a Medigap Plan A through Plan N. Each standardized Medigap policy under the same plan letter must offer the same basic benefits, no matter which insurance company sells it. So cost is usually the only difference between Medigap policies with the same plan letter sold by different insurance companies. If you have original Medicare and a Medigap policy, Medicare will pay its share of the Medicare-approved amounts for covered healthcare costs. Then your Medigap policy will pay its share. Generally, you must have Part A and Part B to buy a Medigap policy. Medigap policies do not cover your share of the costs under other types of health coverage, including Medicare Advantage plans, standalone Medicare drug plans, employer or union group health coverage, Medicaid, VA, or TRICARE. So again, Medigap only works with original Medicare. Also, it may be illegal for the insurance company to sell you a Medigap policy if you already have Medicaid or a Medicare Advantage plan. Medigap policies cover only one person. So if you and your spouse both want Medigap coverage, you'll need to buy separate Medigap policies. You would also each have to pay the monthly Part B premium. And the following slides in this lesson will discuss what you pay in original Medicare and the costs that original Medicare doesn't cover, like copays, coinsurance, and deductibles. And Medigap policies may cover costs original Medicare does not cover. So on this slide that you're seeing right now, the actual dollar amounts are updated yearly. To see the most current amounts, that will be on our website, medicare.gov. But this is what we have for 2024. And this is what you pay per benefit period for Part A covered medically necessary services. So again, Part A is that hospital insurance. And it's pretty much the same for hospital and mental health inpatient stay, meaning after you pay the deductible amount of $1,632 for 2024, you pay no coinsurance for days 1 through 60. Then you pay $408 for coinsurance per day for days 61 to 90. And then $816 for coinsurance per each lifetime reserve day for days 91 and beyond for each benefit period up to 60 days over your lifetime. Then all the costs for each day beyond those lifetime reserve days. And then the last tidbit here is that, or the difference between hospital inpatient stay and mental health inpatient stay is that 20% of the Medicare approved amount for mental health services you get from doctors and other providers while you're a hospital inpatient. So you'd be responsible for those as well. Note that there's no limit to the number of benefit periods you can have when you get mental health care in a general hospital. You can also have multiple benefit periods when you get care in a psychiatric hospital. And remember, there's a lifetime limit of 190 days. So that's our Part A medically covered services. And again, this is available on our Medicare.gov website. So for SNF care, skilled nursing facility care, you'll pay nothing for the first 20 days of each benefit period. $204 coinsurance per day for days 21 through 100 of each benefit period and all costs after day 100. For home health, you'll pay $0 for covered services. After the Part B deductible is met, you pay 20% of the Medicare approved amount for durable medical equipment for providers accepting such assignments. For hospice care, you pay nothing up to $5 per prescription drug to manage pain and symptoms while at home, and 5% of the Medicare approved amount for inpatient respite care. Medicare does not cover room and board when you get hospice care in your home or another facility where you live, like a nursing home. And finally, if the hospital gets blood from a blood bank at no charge, you won't have to pay for it or replace it. But if the hospital has to buy blood for you, you must either pay at the hospital costs for the first 3 units of blood you get in a calendar year, or have the blood donated by you or someone else. Moving on to Part B, covered medically necessary services. It's $240 a year for your Part B deductible and $174.70 or higher, depending on your income, for the Part B premium. You pay 20% coinsurance for most services, like doctor services and some preventive services, if provider accepts assignment. You pay $0 for some preventive services and 20% coinsurance for outpatient mental health services and co-payments for hospital outpatient services.
Okay, great, thank you, Marie. We have our first knowledge check, and you'll see that poll on your screen. It says you must have blank to buy a Medigap policy. So take a minute to select whether you think it's A, Part A, B, Part B, C, Part C, or D, Part A and Part B. And that is correct. The answer is Part A and Part B. So yes, you must have both of those to buy a Medigap policy. Okay, we have another check your knowledge question, and it reads, which of the following statements is not true about Medigap policies? Is it A, Medigap policies are sold by private insurance companies? B, Medigap policies only cover one person? C, Medigap policies may cover costs original Medicare doesn't cover? Or D, each standardized Medigap policy under the same plan letter may offer different basic benefits? Answer is D. So most of you got that correct. And if you didn't, just remember that Medigap policies are standardized and in most states are named by letters. So plans A through D, F, G, and K through N. And each standardized Medigap policy under the same plan letter must offer the same basic benefits, no matter which insurance company sells it. Cost is usually the only difference between Medigap policies that have the same plan letter and are sold by different insurance companies. Okay, so now we'll move into lesson 2. So I'll turn it back over to you, Marie.
Great, thanks, Carrie. You guys did well on those knowledge check questions. That's awesome. And the second one, I think that was a trick question because it's phrased, you know, what's not true. So I think you guys did really well. So I'm glad for that. And ready to dive into lesson 2, where we're going to discuss Medigap policy types, Medigap changes, how plans are structured, and the benefits covered by each type of Medigap policy. And at the end of lesson 2, you'll know about Medigap plan coverage, Medigap changes, different Medigap plans and waiver states, and also Medigap select policies. In most states, Medigap insurance companies can only sell you a standardized Medigap policy identified by letters ranging from A through N. Plans D as in dog and G as in go, with an effective date on or after June 1, 2010, have different benefits than plans D and G bought before June 1, 2010. Plans E, H, I, and J are no longer sold, but if you already have one, you can generally keep it. So that's why when we say plans A through N, there's some, I'll say missing letters there because, some of them are no longer sold. But anyway, each standardized Medigap plan must offer the same basic benefits no matter which insurance company sells it. And we already covered that in lesson 1. The benefits in any Medigap plan identified with the same letter are the same regardless of which insurance company you purchase your policy from. And again, cost is usually the only difference between Medigap policies with the same letter sold by different insurance companies. So to just belabor the point, for example, Medigap Plan N as in Nova, sold by Acme Company, has the same basic benefits as the same Plan N sold by Widget Company, but Acme Company may be selling it at a different price than the Widget Company, okay? Insurance companies selling Medigap policies are required to make Plan A available. If they offer any other Medigap plan, that insurance company currently must also offer either Medigap Plan C or F to individuals who are not new to Medicare, and either Plan D as in dog or G to individuals who are new to Medicare. And we'll look at this more closely on the next slide. I know that's a lot of alphabet soup. But not all types of Medigap policies may be available in your state. So for more information, call the State Health Insurance Assistance Program. So that's the SHIP, or you can also visit shiphelp.org. Medigap policies are standardized in a different way in Massachusetts, Minnesota, and Wisconsin, and those are our waiver states. That's what we call them. But we're going to talk about those last at the end of this, before we end this lesson. So all Medigap policies cover a basic set of benefits. And this is a great chart right here because it shows the differences, and this chart is available on medicare.gov. But let's go ahead and highlight them, right? So it's important to note that that first row, that all plans, A, B, C, all across the columns here, all Medigap plans pay 100% of Medicare Part A insurance, co-insurance, and hospital costs up to an additional 365 days after Medicare benefits are used. Plans F and G also offer a high deductible plan in some states. So it's almost the same in that second row for the Part B co-insurance or co-payment, with a few exceptions. So Plan N in that last column still pays 100% of the Part B co-insurance, except for a co-payment of up to $20 for some office visits and up to a $50 co-payment for emergency room visits that don't result in an inpatient admission. Plan K, kind of like almost in the middle there, a little to the right, pays 50% of Part B co-insurance or co-payment, with Plan L paying 75%. And then moving on to the following rows, plans A, B, C, D, F, G, M, and N pay 100% of blood for first 3 pints, and also for Part A hospice care co-insurance or co-payment. Plan K pays 50%, and then Plan L pays 75%, respectively, for that blood and the Part A hospice care co-insurance or co-pay. And then in addition, each Medigap plan covers different benefits. So here we go, right? Like you can see which plans offer these other benefits. So notice that only certain Medigap plans offer coverage for skilled nursing facility care co-insurance and also the Part A deductible. So not all Medigap policies offer that. Medigap Plan C and F cover 100% of the Part B deductible, but they are no longer available to people newly eligible for Medicare on or after January 1, 2020. Okay, and we're going to dig into that some more, but that's an important point specific to Plan C and F, because C and F covers that Part B deductible, but you have to be a newly eligible Medicare individual by that January 1 or after, on or after that January 1, 2020 date. What else is notable on this chart? Okay, only a couple of plans cover 100% of the Part B excess charges, and a few more cover 80% of foreign travel emergency costs up to plan limits. And to round it out, plans K and Plan L have out-of-pocket limits of $7,060 and $3,530 respectively. Okay, so again, this is a great handy dandy chart, and it's available on Medicare.gov, and that's one of our resources. So let's talk about some changes to Medigap. And one was the Medicare Access and CHIP Reauthorization Act of 2015. So that's Macra. It changed who's eligible to buy a Medigap policy that provides coverage of that Part B deductible. So that's the Plan C and F that I was emphasizing in the previous slide. So insurance companies selling Medigap policies were prohibited from selling Plan C or F to people who turned 65 on January 1st, 2020 or later, or to people who get Part A due to disability or end-stage renal disease as of January 1, 2020 or later. Again, you'll recall from the previous slide that Medigap Plans C and F cover 100% of the Part B deductible, but they are no longer available to people newly eligible for Medicare on or after January 1, 2020. So if a person who was not a newly eligible Medicare Benny on January 1, 2020 or later can apply to buy Plan C or F, and the insurance company is allowed to sell that policy by Macra. The insurance policy is not required to sell that policy, and they'll only have guaranteed issued rights if they're in your open enrollment period, or if you have guaranteed issued rights under other limited circumstances. Your Medigap OEP, open enrollment period, begins the month you're 65 or older and signed up for Part B. You must also have Part A. So, that's our first knowledge question, right? In order to get Medigap, you have to have both Parts A and B. Guaranteed issue rights are your rights to buy certain Medigap policies in certain situations outside of your Medigap OEP. But let me not get ahead of myself. Derek's going to talk about guaranteed issued rights later on in lesson 4. Insurance companies can sell a Plan C or F to a person who started to get retroactive Medicare premium-free Part A before January 1, 2020. So I hope that makes sense, right? It's that January 1, 2020 date. If it's before that, then a Medicare Benny can get Medigap Plan C or F. If it's after that, they cannot. But if you have them, so if a Medicare beneficiary has Medigap Plan C and F and remain active for people who already have them, they can keep them. But there are guaranteed renewable. They're also guaranteed renewable for people who already have them. And if the premiums are not paid, these plans would be lost, and then you wouldn't be able to get them back. There is not a federal guaranteed issued rate for people with Medicare, with Medigap Plan C or F to change to other plan types. So if, for example, you have Plan C or F because you got it or you were eligible for Medicare before January 1, 2020, but then you wanted to change and try out or, go to Plan N or a different letter, there's no federal guaranteed issued rights to go back to your Plan C or F. But some states, it would be best to check with your state insurance department about what rights you might have under that specific state law. But federal, as far as the federal guaranteed issued rights is concerned, there is none. Now let's talk waiver states. So these are Massachusetts, Minnesota, and Wisconsin. And a waiver state means that they provide different kinds of Medigap policies because they're not labeled with the letters, A through N. They also provide comparable benefits to standardized policies. And they have different systems that includes a basic core and an optional rider benefits. So waiver states are required to implement those Macra changes, right? So this means that people who are new to Medicare as of January 1, 2020 are not eligible to purchase a Medigap policy that provides coverage for that Part B deductible. So again, check with the states or for updates or contact the SHIP. Information on the coverage provided in these states is available in the Choosing a Medigap Policy, a guide to health insurance for people with Medicare. And that too is in our Medicare.gov website under publications. And that same publication includes that, chart that I was raving about a couple of slides ago. Okay, our last Lesson 2 topic is Medicare Select. So Medicare Select is a type of Medigap policy sold in some states that requires you to use hospitals and in some cases doctors within its network to be eligible for full insurance benefits except in an emergency. So Medicare Select can be offered as any of the standardized Medigap policies. They typically will cost less than other Medigap policies. Again, but if you don't use their Medicare Select network hospital or doctor for non-emergency services, you'll have to pay some or all of what Medicare doesn't pay. Medicare will pay its share of approved charges no matter which hospital or doctor you choose. And if you currently have a Medicare Select policy, you also have the right to switch at any time to any regular Medigap policy being sold by the same company. The Medigap policy you switch to must have equal or fewer benefits than the Medicare Select policy you currently have. If you have a Medicare Select policy and you move out of the policy's area, you can buy a standardized Medigap policy from your current Medigap insurance company that offers the same or fewer benefits than your current Medicare Select policy. If you've had your Medicare Select policy for more than 6 months, you won't have to answer any medical questions. You can use your guaranteed issue rate to buy Medigap Plan A, B, C, F, K, or L that's available for sale in most states by any insurance company. Again, Plan C and F, are no longer available for those who became new to Medicare on or after January 1, 2020. But if you are one of those folks who became eligible for Medicare on or after January 2020, you have the right to buy Plan D as in dog or G as in go instead of C or F. And as I previously mentioned, Derek's going to talk about the guaranteed issued rights in lesson 4. And just one last note, Medicare Select policies are not available in all states. So again, if you need to see what's available in your state, call the state insurance department or the SHIP in your respective state.
Thank you so much, Marie. That's some great information. We're going to have another check your knowledge come up now. So this one is a true or false. All Medigap plans pay 100% of Medicare Part A hospital insurance, co-insurance, up to an additional 365 days after Medicare benefits are used. The answer is true. So remember, all Medigap policies cover a basic set of benefits. All plans pay 100% of Medicare Part A co-insurance and hospital costs up to the additional 365 days after Medicare benefits are used. So that one is true. Right, we have another one. This one is also a true and false. Since January 1st, 2020, Medigap plans sold to people new to Medicare are not allowed to cover the Medicare Part B deductible. So the answer is true. Okay, so most of you had that right. Medigap plans sold to people new to Medicare aren't allowed to cover the Medicare Part B deductible. So that's that. And the Medicare Access and Chip Reauthorization Act of 2015, or Macra, changed who's eligible to purchase a Medigap policy that provides coverage of a Part B deductible. So because of that, Part Plans C and F are no longer available to people new to Medicare on or after January 1st, 2020. And there's a couple exceptions to that. If you already have either of those two plans, or the high deductible version of Plan F, or you were covered by one of these plans before that date, you can keep your plan. If you're eligible for Medicare before January 1st, 2020, but haven't enrolled yet, you might be able to buy one of these plans. And then for this situation, people new to Medicare are people who turned 65 on or after January 1st, 2020, and people who get Medicare Part A on or after January 1st, 2020. So just a little clarification there. Okay, thank you, Derek, and go ahead and kick things off with lesson 3.
Good afternoon, everyone, and thank you, Marie, for that amazing and insightful presentation of our first 2 Medigap lessons. I am going to pick up with lesson 3 and talk about all of the things that need to be considered when individuals are considering the purchase of a Medicare Supplement Insurance policy. This lesson will cover Medicare Supplement Insurance, or Medigap, policy costs, the best time to buy a Medigap policy, how you can switch from one Medigap policy to another, if it's possible, and all of the steps that need to be considered when purchasing a Medigap policy. At the end of this lesson, you'll be able to explain what determines how much you pay for Medigap, identify the best time to buy a Medigap policy, and explain guaranteed issue rights, and will also provide steps to buying a Medigap policy. Okay, great. So let's go back and talk again about how the differences in premiums can occur with different insurance companies. Again, different insurance companies can charge for exactly the same coverage. And how much you pay can depend on whether you're in your Medigap open enrollment period, your age. In some states, people under 65 cannot buy a Medigap policy, and in some states, they allow companies to sell Medigap policies that could cost more based on whether you're older when you buy it or when you get older. Where you live. Sometimes the policies are based upon zip code and the areas that you live in as well. And then the company that's providing the policy or the plan. Additionally, whether or not the company offers discounts. Sometimes it's two individuals in the same household are purchasing from the same company, they will offer a discount. And then whether or not medical underwriting is used. We're going to be talking more about medical underwriting as we go through the presentation. Medical underwriting simply means that pre-existing conditions can be considered when rating your policy. And finally, there could be different prices in the premiums based upon whether or not it is a Medicare Select policy. Let's talk more about Medigap pricing based upon age. No age-rated community rating policies are policies that are based upon everyone being charged the same rate, no matter how old they are. In general, no age-rated Medigap policies are the least expensive over your lifetime. If people with Medicare under 65 have the right to buy a policy, premiums can be rated differently and they can be charged more. Your premium may not go up, though, because of your age. And then there's issue age-rated policies. The premium for these policies is based on your age when you first buy the policy. Premiums are lower for people who buy at the younger age, but your premium may not go up because of your age. And then finally, there are attained age-rated policies. And the premiums for these policies are based on your age each year. These policies are generally cheaper at 65, but their premiums go up automatically as you get older. In general, attained age-rated policies cost less when you're 65 than issue age-rated or no age-rated policies. However, when you reach 70 to 75 years of age, attained age-rated policies usually become the most expensive. So when you compare premiums, be sure you're comparing the same Medigap plan, whether it's standardized plan A or any of the other plans through N. And note that premiums for all types of pricing may go up because of inflation and or other factors. Let's talk now about the best time to buy a Medigap policy. Usually the best time to buy a Medigap policy is during your Medigap open enrollment period. This period lasts for 6 months. And it begins on the first day of the month that you are both 65 years or older and enrolled in Medicare Part B, or medical insurance, or as we call it, supplemental medical insurance. You must also have Medicare Part A, hospital insurance, to have a Medigap policy. You have a 6-month Medigap open enrollment period, which gives you a guaranteed right to purchase a Medigap policy. Some states may have a longer period, and few have continuous open enrollment. Once the federal Medigap open enrollment period, which is a 6-month period, begins, it cannot be delayed or repeated. If you're under 65 and have Medicare because you have a disability like end-stage renal disease, you might not be able to purchase the Medigap policy you want or any Medigap policy until you turn age 65. Now again, turning the age 65 is a key number, particularly for those who are enrolled in Part B. That will trigger the open enrollment period, or the federal Medigap open enrollment period. And again, as we said previously, anyone who is in that open enrollment period cannot be denied the purchase of a Medigap policy from any issuer in your state. Let's talk more about your rights when buying a Medigap policy. During your open enrollment period for Medigap, insurance companies cannot use medical underwriting to decide whether to accept your application, and they can't refuse to sell you any Medigap policy they offer. They can't charge more because of a past or present health problem. They can't make you wait for coverage. There can, however, be a waiting period for coverage of the pre-existing condition if you did not have creditable coverage before the OEP. You may want to apply for a Medigap policy before your open enrollment period starts so that the coverage will start immediately on the first of the month that you turn the age 65. This will ensure that you have continuous coverage without any break in coverage. In most cases, it makes sense to sign up for Part B and buy a Medigap policy when you're first eligible for Medicare, because you might otherwise have to pay a Part B late enrollment penalty, and you might miss your 6-month Medigap open enrollment period. However, there are exceptions if you have employer coverage. If you have group health coverage through an employer or union, because either you or your spouse is currently actively working, you may want to wait to sign up for Part B. Benefits based on current employment often provide coverage similar to Part B, so you wouldn't want to pay for Part B before you need it. And your Medigap open enrollment period might expire before a Medigap policy would be useful. But when the employer coverage ends, you'll get a chance to sign up for Part B without a late enrollment period, which means you can then use your Medigap open enrollment period, which will start when you're ready to take advantage of it. If you or your spouse is still working and you have coverage through an employer, you should contact your employer or union benefits administrator to find out just how your insurance policy works with Medicare. Remember, again, if you took Part B while you had employer coverage, you don't get another chance at the Medigap OEP. Medigap OEP is triggered when you've attained the age of 65 and you enroll in Part B. So it's very important that you don't find yourself locked out of that because you didn't decide to get Medigap earlier at the time when that OEP was available. This information is just more repeating the things that we just said, emphasizing that you could be paying for duplicate coverage, and very important to get your timing correct in that particular situation. Let's talk more about pre-existing conditions in Medigap. Pre-existing conditions are health problems for which you were treated or diagnosed within 6 months of the start coverage date. And the insurance company may be able to make you wait for a coverage related to a pre-existing condition, which again is a health problem you had before the start date. And it's called a pre-existing condition waiting period because it lasts for 6 months after the Medigap policy begins to cover you. Coverage for a pre-existing condition can only be excluded in a Medigap policy if the condition was treated or diagnosed within 6 months before the coverage starts under the new Medigap policy. This is called the look-back period. Original Medicare will still cover the condition. So in other words, your Part A coverage or your Part B will kick in and you'll have the coverage through Medicare. But original Medicare does not take care of the standard out-of-pocket costs, and you will be responsible for those until your Medigap policy kicks in to cover them. If you buy a Medigap policy during your Medigap open enrollment period and you're replacing other types of health coverage that count as creditable coverage, and that's generally any other health coverage that you recently had before applying your Medigap policy. It would be possible, however, if you had that creditable coverage to avoid or shorten the look-back waiting period if you had at least 6 months of continuous prior creditable coverage with no breaking coverage for more than 63 days. The Medigap company cannot make you wait before it covers your pre-existing conditions. You can learn more about creditable coverage by reviewing the CFR or the Code of Federal Regulations at 146.113. Medigap for people with disability or end-stage renal disease. So if you're under 65 and have Medicare because of a disability or end-stage renal disease, or if you're dealing with a kidney transplant, you might not be able to purchase the Medigap policy that you wish to get, or any Medigap policy until you turn age 65. Federal law doesn't require insurance companies to sell Medigap policies to people under age 65 and eligible for Medicare coverage due solely to ESRD. Some insurance companies, however, may voluntarily sell Medigap policies to people under age 65, although they will probably cost you a lot more than Medigap policies sold to people over 65, and they can use medical underwriting. It's important that you check with your state insurance department about state-specific requirements and what rights you might have under state law. Remember, if you're already signed up for Part B, you'll get a Medigap open enrollment period when you turn age 65. You'll probably get a better price at that time as well. Let's talk more about the steps to purchasing a Medigap policy. The first thing you want to do is to decide what benefits you want and which Medigap policy will meet your needs. You want to think about your current and future healthcare needs when deciding which benefits you want, because you might not be able to switch Medigap policies later. Then you want to find out which insurance companies sell the Medigap policies that are in your state. Ask your state insurance department if they have a Medigap rate comparison shopping guide for your state, because this guide usually lists the companies that sell Medigap policies in your state and their costs. You can also contact your state insurance department or visit Medicare.gov in order to figure out information for contacting your state insurance department and more information on Medicare rates and plans. If you don't have a computer, we urge you to go to your local library or senior center to get more information on the plans and their rates. You also want to call the insurance company that sells the Medigap policies you're interested in and compare the costs. Use the checklist in choosing a Medigap policy, a guide to health insurance for people with Medicare. This is a CMS publication, and the product number is 02110. See the link below to help compare. You also want to buy the Medigap policy, of course. Once you decide on the insurance company and the Medigap policy you want, you should apply for that policy. The insurance company must give you a clearly worded summary of your Medigap policy and the explanation of benefits. All of these steps are described in greater detail in our Choosing a Medigap Policy, which is a guide to health insurance for people with Medicare. It's CMS product number 02110, and you can find that at our Medicare.gov publications website. Let's talk now about how you can switch Medigap policies if you can and when you can. You have limited opportunities to switch Medigap policies. You may want to switch Medigap policies if you're paying for benefits you don't need. Or if you need more benefits now, you may want to change your insurance company, or you may want to find a cheaper policy. If you bought your Medigap policy before you were age 65 because you had a disability, again, you get a Medigap open enrollment period. So when you turn 65 and you're enrolled in Part B, you're very likely able to get, well, one, you'll be able to get any Medigap policy that's sold in your state, but two, you will most definitely get a cheaper price because the plans can no longer subject you to medical underwriting. If you had your old policy for less than 6 months, the insurance company may make you wait and delay coverage of a pre-existing condition for up to 6 months. If your old policy had the same benefits and you had it for 6 months or more, the new insurance company can't exclude your pre-existing conditions. If you had your policy for less than 6 months, the number of months you had your current Medigap policy must be subtracted from the time you must wait before your new policy covers your pre-existing conditions. If the new Medigap policy has a benefit that isn't in your current policy, that benefit coverage may still be delayed up to 6 months, regardless of how long you had your current Medigap policy. And then finally, if you had your current Medigap policy longer than 6 months and want to replace it with a new one with the same benefits, and the insurance company agrees to issue the new policy, they cannot write pre-existing conditions, waiting periods, or elimination periods, or probationary periods into the new replacement policy. All of those fun facts are listed there. And again, these slides will be available for you in the chat. Let's talk more about when you can switch Medigap policies. In most cases, you have the right under federal law to switch Medigap policies if you are within your Medigap open enrollment period. If you're not in your Medigap open enrollment period and switch to Medigap policies, You will likely pay more for the new policy, and there may be medical underwriting, and you could have a delay in coverage for a pre-existing condition if you had your old policy for less than 6 months. Or you could have a guaranteed issuance right. This is a right you have in certain situations when insurance companies are required by law to sell you a Medigap policy. Guaranteed issuance rights are very, very important because they determine if, one, you're able to get a policy, and then also how much you're going to pay for the policy. The Medigap OEP is a federal guaranteed issuance right. However, some states have more generous requirements. Some states have an open enrollment period all year around. But in any case, you can always approach an insurance company to see if they will sell you a policy. They may sell you a policy because they're interested in building their market in the area that you live. But just because you don't have a guaranteed issuance right doesn't mean that we will not be able to get a Medigap policy. So we encourage folks to call the insurance companies that are in their area to see what offerings might be available. Again, you have a 30-day free look period when you switch to a new Medigap policy. You'll need to pay the premiums for both for 1 month. So this is an opportunity for you to actually try before you let go of the other policy to make sure that you have continuous coverage.
Thank you so much, Derek. We have yet another check your knowledge question, and we can go ahead and click to start that timer. Which of the following is true of issue age-rated policies? Is it A, everyone pays the same regardless of age if you're 65 or older? B, your premium is based on your current age? C, your premium is based on your age when you bought the policy? Or D, costs go up automatically as you get older? The answer is C, correct. Your premium is based on your age when you bought the policy. And remember, the premium for issue age-rated policies is based on your age when you first buy the policy. Premiums are lower for people who buy at a younger age, and your premium may go up because of your age. No age-rated policies charge everyone the same rate, no matter how old they are. And the premium for attained age-rated policies is based on your age each year. Okay, and we have another knowledge check. This one is the Medigap OEP, open enrollment period, starts blank. Is it A, the first day of the month you're 65 or older? B, the first day of the month you're 65 or older and enrolled in Part B? Or is it C, October 15th each year, the same time as Medicare open enrollment? The answer is B. Very good job. That is when the open enrollment, Medigap open enrollment period starts. Remember, you must also have Medicare Part A to have a Medigap policy, and usually the Medigap OEP is the best time to buy a Medigap policy. And Derek, I'll turn it over to you again.
Awesome. So we're going to start our lesson 4. And in lesson 4, we're going to talk about Medicare Supplement Insurance, Medigap rights and protections. This lesson will explain guaranteed issuance rights to buy a Medicare Supplement Insurance policy or a Medigap policy, and which policies are guaranteed renewable, and when you may be able to suspend a Medigap policy. At the end of this lesson, you'll be able to explain guaranteed issuance rights, guaranteed renewal, and policy suspension rights, and learn where to get more information on Medigap rights and protections. So let's talk about your rights. Guaranteed issuance rights are your rights to buy a certain Medigap policy in certain situations outside of your Medigap open enrollment period. The next 2 slides will describe the most common situations under federal law where you may be able to buy a Medigap policy outside of that 6-month Medigap OEP that we've been talking about. It'll talk about the kinds of policy you can buy. They will talk about the types of policy you can buy, and we'll also discuss when you can or must apply for those policies. You may have additional rights, again, under state law, so make sure to check with your state insurance department about your specific rights for your specific state that expand beyond the federal benefits. So let's talk about John. John is currently in a Medicare Advantage plan, and he will have Medigap guaranteed issuance rights if he joined the plan when he was first eligible for Medicare Part A hospital insurance at 65. And in the first year, he wants to change to original Medicare. This is the 12-month trial right that is afforded to individuals who, at age 65, purchase both Medicare Part A and Part B and elect, as Marie was discussing earlier in our presentation, they elect to get their Medicare benefits through Medicare Advantage. Such an individual has 12 months to try that Medicare Advantage plan. If they decide they do not want to stay with that Medicare Advantage plan, they have the option to go back to original Medicare and purchase any Medigap policy that's sold in their state by any insurance company. Now, other guaranteed issuance rights include if you're in a Medicare Advantage plan and your plan is leaving Medicare, or if your plan stops giving care in your plan service area. You can refer to Appendix B later on in the presentation for a more comprehensive list of guaranteed issuance rights. We'll be talking about those a little later. Let's talk about another situation. Let's talk about Mary. Mary has original Medicare. And let's talk about the times when she'll have Medicare, Medigap guaranteed issuance rights. Such an individual will have the right to buy a Medigap policy if they have original Medicare and a group health plan. That coverage can be like from an employer, including retiree or COBRA coverage or union coverage that pays secondary to Medicare. And if that plan ends, such an individual would also have the right to buy a Medigap policy if they have Medicare Select policy and they move out of the plan service area. They also have an opportunity to get a Medigap plan with guaranteed issuance rights. In most cases, Medigap policies purchased after 1992 are guaranteed renewable. Your insurance company cannot drop you unless one of the following things happen. You stop paying your premiums. You weren't truthful on your Medigap policy application, or if the insurance company becomes bankrupt or insolvent. If you bought your Medigap policy prior to 1992, it might not be guaranteed renewable. This means the Medigap insurance company can refuse to renew your Medigap policy as long as it gets the state's approval to cancel it. However, if this does not happen, you will have the right to buy another Medigap policy. There are also opportunities for individuals to suspend their Medigap policy, and this is for people with Medicaid. So if you have both Medicare and Medicaid, most of your healthcare costs are covered. Medicaid is a joint federal and state program, and the coverage varies from state to state. People with Medicaid can get coverage for things that aren't covered by Medicare, like some nursing home care and some home health care. If you already have Medicaid, an insurance company can't legally sell you a Medigap policy unless one of the following is true. Medicaid pays your Medigap premium. Medicaid pays all or part of your Medicare Part B medical insurance premium. And now remember that the insurance company may use medical underwriting, which could affect acceptance, cost, and the date of the coverage. There are a few things you should know if you have a Medigap policy and then become eligible for Medicaid. Here we're talking more about the suspension. You can put your Medigap policy on hold. In other words, you can suspend it within 90 days of getting Medicaid. You can suspend your Medigap policy for up to 2 years. However, you may choose also to keep your Medigap policy in place so that you can see the doctors who don't accept Medicaid, or if you no longer meet the Medicaid spend down requirements. At the end of the suspension, you can restart the Medigap policy without new medical underwriting or waiting periods for pre-existing conditions. Remember though, if you suspend the Medigap policy you brought before January 2006 and it included drug coverage, you will not be able to get the Medigap policy back except for without prescription drug coverage. And all of that's because of the new, well, not the new Part D benefit anymore, but Medigap policies can no longer include drug coverage that are resold after 2006. Let's talk a little bit more about the suspensions of Medigap for people with Medicaid. There are advantages to suspending your Medigap policy rather than dropping it. If you put your Medigap policy on hold, you won't have to pay the Medigap premiums while it's suspended. But keep in mind that your Medigap policy won't pay benefits while it's in suspense status. You may suspend your Medigap policy if you get Medicaid. However, you may not want to do this if you want to see the same doctors who don't accept Medicaid. For help with the decision, call 1-877-839-2675 to be connected to the State Health Insurance Assistance Program in your state, or visit shiphealth.org. For questions about suspending a Medigap policy, call your Medigap insurance company. And for more detail about the right for people with Medicaid to suspend a Medicaid policy, you can find that information on SSA's website. All of this additional information can be found in the slide. And remember also, if you drop your Medigap policy, you may not be able to get it back. More information on Medigap rights and protections, contact your state Department of Insurance, contact your local health insurance assistance program, or dial 1-800-MEDICARE, or visit us on any of the websites you see below.
Great. Lots of very, very good information about Medigap here. We're going to move on to our last two knowledge checks. We have this one. You may not qualify for a guaranteed issue right if blank. Is it A, you're in a Medicare Advantage plan and your plan is leaving Medicare? B, you move out of your Medicare Advantage plan service area? C, you have original Medicare and miss your Medigap OEP? Or D, you joined a Medicare Advantage plan when you first became eligible for Part A, and within a year, you want to switch to original Medicare? The answer is C. You have original Medicare and miss your Medigap OEP. So that's when you might not qualify for guaranteed issue right. All right. Next, the next knowledge check is if your Medigap policy isn't guaranteed renewable and the insurance company cancels it, you have the right to buy another Medigap policy. Is that true or false? It is true. Great job. If you bought your Medigap policy before 1992, it might not be guaranteed renewable. This means that the Medigap insurance company can refuse to renew your Medigap policy as long as it gets the state's approval to cancel your policy. However, if this does happen, you have the right to buy another Medigap policy. All right, I'll turn it back over to you, Derek.
Great.
Great.
I think Marie's going to have me.
Great, thanks. Yes, I'm back. Thank you so much. So yeah, at this time, let's dig in and apply what we've been talking about and go through some scenarios. So I'm going to post some scenarios and our subject matter expert, Derek, will be providing us some answers. So let's consider that Ted is 64 and he's had Medicare for 4 years due to disability. He was able to purchase a Medigap policy because he lives in a state that requires insurance companies to offer a Medigap policy to people with Medicare who are under 65. So what might change when Ted turns 65 next year, Derek?
Well, let's talk about some of the things that opportunities that Ted would have. Ted will, in fact, have a Medigap open enrollment period when he turns 65 because he's enrolled in Part B. He'll also have a wider choice of Medigap policies and be able to get a lower Medigap premium. And then in addition to all of this, since Ted is signing up during the Medigap OEP, insurance companies cannot refuse to sell him any Medigap policy due to his disability or charge him a higher premium than they charge other people of the same age. So Ted can avoid waiting periods for pre-existing conditions if he had continuous qualifying coverage or hasn't gone without health care coverage for more than 63 days prior to the effective date of the Medigap policy. Because Medicare Part A, hospital insurance, and or Part B, medical insurance is qualified coverage, and Ted had Medicare for more than 6 months before he turned 65, he will not have a pre-existing waiting period. Let's say that Ted only had Medicare for 4 months before he turned 65. No other health insurance for more than 63 days prior to getting Medicare, and got his Medigap policy during the first month of his Medigap OEP. Now, in this case, Ted might have a 2-month pre-existing condition waiting period. During this time, the Medigap company can refuse to cover Ted's out-of-pocket costs for his pre-existing health problems. Very important to note that the refusal to cover those out-of-pocket costs are limited to just the pre-existing health conditions. Medicare will still cover the Medicare coverage services associated with Ted's condition, and Ted will be responsible for the deductibles, co-insurance, and co-payments. However, after the pre-existing condition waiting period ends, the Medigap policy will cover the condition that was excluded.
Great. Thanks for that thorough response, Derek. If you don't mind, let's go through another scenario, please.
Of course.
So Sophie is 65 and healthy. She retired last month and ended her employer-sponsored health coverage. She was enrolled in Part A and just enrolled in Part B. She's interested in buying a Medigap policy to help her with her out-of-pocket costs. So what does Sophie need to consider?
Let's talk about the things Sophie needs to consider. Sophie should buy a Medigap policy during her OEP, and that period lasts for 6 months and begins with her Part B effective date. During this period, Sophie has guaranteed issuance rights, and insurance companies must sell her a Medigap policy and cover all of her pre-existing conditions and cannot charge her more for a Medigap policy based upon her past or present health problems. So what if Sophie waited a year to buy this Medigap policy? After her Medigap OEP, or open enrollment period, the Medigap insurance companies are generally allowed to use medical underwriting to decide whether or not to even accept an application and then how much they would charge. There's no guarantee that an insurance company will sell Sophie a Medigap policy if she doesn't enroll within the time allotted under her federal or state laws. So you can see there's some really important steps that need to be taken within certain time frames in order to exercise the guaranteed issuance rights, particularly the federal OEP. Those guaranteed issuance rights, again, can vary from state to state. Some states have more generous benefits, but none of the states have anything less than the federal minimum standard. The federal OEP is a federal minimally required open enrollment period of all states. Okay, I think what we're going to do now is just have an overview of several key points that we think we want to drive home before we end our presentation today. there are some key points that you want to know, and that's how to buy a Medigap policy. You must have Part A and Part B to purchase a Medigap policy. If you buy a Medigap policy, you must continue to pay your Part B premium. It is a separate charge that is paid to Medicare. You pay the insurance company a monthly premium for your Medigap policy. Medigap policies only cover individuals. Your spouse would not be covered under your policy. If your spouse wants Medigap coverage, he or she would have to purchase their own individual policy. Medigap insurance companies in most states can only sell you a standardized Medigap policy. Each standardized Medigap policy must offer the same basic benefits no matter which insurance company sells the policy. More points. The cost for a Medigap policy can vary by the plan you choose and by the company from which it's purchased. In general, Medigap policies can only cover costs associated with services covered by Original Medicare. Medigap policies do not work with Medicare Advantage plans. Insurance companies selling Medigap policies can't sell plans C or F to people who turn 65 on January 1st, 2020 or later, or to people who get premium-free Part A due to a disability or end-stage renal disease as of January 1st, 2020 or later. This is, again, re-emphasizing the points that my colleague Marie brought up earlier with the provisions that were changed with Macra. Those went into effect on January 1st, and they make it illegal for insurance companies to provide or to sell any Medigap policy to individuals that have coverage of the Part B deductible. Here we have some Medigap resource materials that we'd like to share with you. All of the telephone numbers to 1-800-MEDICARE are there. We also have many guides on our website through medicare.gov, and we have our Medigap guide, the guide that specifically goes through all of these particular situations for trial rights, for guaranteed issuance rights, rating methodologies, attained rating, attained age rating, community-based rating. So many of the different facts that we've talked about on this through this presentation. It's a lot of material, but these particular resources are very helpful. You can also reach out to your state health insurance assistance programs, and for regulators, you can also work with the National Association of Insurance Commissioners to get information about what some of the other challenges and things that other states are dealing with the implementation oversight of Medigap provisions. Again, here are some more materials that you can use. The Consumer Guide Choosing a Medigap Policy is an extremely useful resource. It covers so many of the complex things that are more difficult to understand in the statutory provisions. And then we also have another Medicare publication. It's called Medicare Coverage Outside of the United States. That particular brochure discusses how Medicare typically does not have coverage outside of the United States except for very limited circumstances. Very important in the context of this presentation because there are some Medigap policies that will cover things that Original Medicare will not. Again, it's probably important to go a little bit over the contrast between Medicare Advantage and Medigap policy. This chart actually gives a side-by-side comparison of how the two differ. Both Medigap and Medicare Advantage are offered by private insurance companies. Medigap must follow federal and state laws, but routine day-to-day oversight of standardized Medigap plans is a responsibility of the state. Medicare Advantage plans, on the other hand, must be approved by Medicare. Medigap policies only work with Original Medicare. In other words, they do not coordinate with Medicare Advantage. If you join a Medicare Advantage plan, you can't use a Medigap policy to pay for out-of-pocket costs that you have in the Medicare Advantage plan. This is such a serious point that it's actually illegal for agents or brokers or insurance folks who sell insurance policies to even sell you a Medigap policy if you are currently enrolled in a Medicare Advantage plan. This is an anti-duplication provision, which helps to protect consumers from buying insurance that would be useless for them. Continuing on, Original Medicare pays for many, but not all health care services and supplies. Private insurance companies sell Medigap policies to help pay for some of the out-of-pocket costs that Original Medicare does not cover. Medigap policies do not cover out-of-pocket drug expenses. If you want prescription drug coverage, you'll need to consider joining a Medicare drug plan, also known as a PDP or Part D. Some older policies no longer sold, and again, we're talking about older Medigap policies no longer sold, may have included some prescription drug coverage, like Plan I. Medicare Advantage plans cover Medicare Part A hospital insurance and Part B medical insurance. Those covered services may include Medicare drug coverage and may offer extra coverage like vision, hearing, dental, and wellness programs. In both cases, however, you must have Part A and Part B if you buy a Medigap policy. You will pay a premium for a Medigap policy or a Medicare Advantage plan in addition to the Part B premium. If you already have a Medicare Advantage plan, it's illegal, as we just mentioned, for anyone to sell you a Medigap policy unless you're disenrolling from your Medicare Advantage plan to go back to Original Medicare. So we talked about Medicare guaranteed issuance rights situations before, particularly in the context of the OEP, but then there are several other situations that when very specific circumstances occur and they're met and the individual finds themselves in these situations, there are these very limited situations where an individual will have a guaranteed issuance right. The first one is if you're in a Medicare Advantage plan and your plan is leaving Medicare or stops giving care in your area, or you move out of the plan service area. You can see in the center of the slide that the Medigap plans that you're able to purchase. There's so many that are listed there. I'm not going to go through the entire presentation and list all of the plans, but you can also see that there's a time period and it's limited. You can get these plans with guaranteed issuance rights as early as 60 days before the Medicare plan coverage will end, but no later than 63 days after the coverage ends. And the Medigap coverage cannot start until the Medicare Advantage plan ends. So in other words, an insurance company cannot sell you a Medigap policy for a period that coincides with an active Medicare Advantage plan enrollment. But the provision that allows you to purchase it 60 days in advance allows you to stage so that the day you go back to Original Medicare, you will have immediate coverage for the coinsurance, deductibles, and copays that might be associated with your Original Medicare coverage. You also have other guaranteed issuance rights. For instance, if you have Original Medicare and an employer group plan, including retiree or COBRA coverage, or union coverage that pays after Medicare pays, and that plan ends, you have rights, and those rights are outlined to cover which plans you can get. You can see them in the center of your screen, and then also the dates that are applicable to you in that situation are also found in the third column of this sheet. Again, you have if you have Original Medicare, again, another example, and a Medicare Select policy, we talked about this a little earlier, and you move out of that Medicare Select policy service area, you can call that Medicare Select insurance company for more information about your options. This is a very important guaranteed issuance right, because if you move out of the area that the network, for which the network provides services, that policy is not really useful to you. That's why this federal provision allows for individuals to move to get to a different Medicare policy, Medigap policy, if they move out of that service area. And then the corresponding plans that you have a right to purchase and the time frames to purchase those plans are also listed in the middle and last column of this slide. Additional Medigap guaranteed issuance rights include a trial right for an individual who tries Medicare Advantage for the first time, when they were first eligible for Medicare at the age of 65. So again, here's that 12-month period that these individuals have. And if you do it, if you get Medicare Advantage when you're 65, it's the first option that you select to get your Medicare benefits. You, like an individual who's in the OEP, has the ability to purchase any Medigap policy that's sold in your state. And again, the timeframes are, with that associated guaranteed issuance right, are listed on the far right of your screen. Then there's another trial right for Medicare Advantage individuals for folks who've joined Medicare Advantage for the first time. So for instance, you could have been in original Medicare from the age 65 to maybe 70 and then decided that you wanted to try Medicare Advantage for the first time. That's why these guaranteed issuance rights are called trial rights, because you're trying MA for a limited period. So for an individual who is trying MA for the first time or Medicare Advantage, they also, like the individual at age 65, get a chance to try a Medicare Advantage plan. In this case, however, such an individual can only go back to the Medigap policy that they had prior to switching to Medicare Advantage. So this one is different from the Medicare Advantage trial right for the person who started with Medicare Advantage to receive their Medicare benefits at age 65. And again, the corresponding time periods that are associated with this particular trial right are listed in the far right corner of your slide. Then there's two other circumstances that we want to highlight. And one of them is if the Medigap insurance company goes bankrupt and you lose your coverage, or your Medigap policy coverage otherwise ends through no fault of your own. You can see the policies that you have the right to buy in that instance in the center of your screen, and also the timeframes associated with getting a new policy. If you do not exercise the guaranteed issuance rights in any of these situations within the timeframe specified, you will lose the opportunity to purchase a Medigap policy with a guaranteed issuance rights. And then finally, we have the circumstance if you are in a Medicare Advantage plan or you drop a Medigap policy because the company hasn't followed the rules. And what this means in either case, if there is misrepresentation in the contract that you signed with a Medicare Advantage organization or with the Medigap policy where there wasn't full disclosure or fraud in the execution of your contract, you have the right to buy all of the policies that are listed in the center, and again, within the specified time frames that you see in the far right slide. Again, just hitting back again on the Macra provisions, Plan C and F are no longer available to people that are new to Medicare on or after January 1st. Very important to keep in mind. So during the presentation, we threw out a lot of acronyms. I'm very glad that we're making this available so that you don't have to feel rushed to read through all of these. Again, you can look in the chat. You'll be able to pull down the presentation and look over these acronyms if we lost anyone in the process. And now I'm going to turn it back over to our Office of Communications for a Q&A session.
Great. Thank you so much, Derek. Great presentation and lots of great resources as you just explored there. So we appreciate that. As you may expect, there are lots of questions that have been coming in, and we've been trying to answer as many as we can, but we do have some that we would like to ask you and Marie aloud. So I'm gonna go ahead and start off with this question. If your Medigap insurance company cancels your policy due to closure, are you guaranteed coverage from another insurance company regardless of your current health conditions, since it wasn't your fault that you lost your coverage?
Could you, the first part of the question, you said during closure, something like, I didn't hear the first part.
Due to closure, like I'm taking that as maybe the company closed or, shut down.
Yes. Yes, and that was one of the guaranteed issuance rights that we just discussed on one of the most recent slides If the policy ends through no fault of your own, there's nothing you could have done about it, you will have guaranteed issuance rights and the specific rights that are associated with that particular GI right. And the timeframes were in that chart that we just talked about.
Okay, great. This next question is, well, I'm wondering if there's a little confusion here, but I'll go ahead and read it and I'll let you determine. So if you miss your open enrollment period and want to leave your Advantage plan as you develop health issues, you can move to a different area that does not have your Advantage plan and you will have a guaranteed issue. So they're asking that as a question. So I think what they're saying here is if they really want to leave their Advantage plan, but they're having health issues, they want to know, can you move to a different area? And if they don't have your Advantage plan, you'll have a guaranteed issue. So a couple things going on there.
I'm not sure I fully understand the question. It sounds like we have an individual that is currently enrolled, for instance, maybe in one state, in a Medicare Advantage plan, and then they move to another state. And well, when they move to the other, they move to the new state, will they have guaranteed issuance rights? I think there are a couple of other situations that, or facts that we would need to say, yes, in fact, that person does have guaranteed issuance rights into Original Medicare. And I'd like to welcome that person to reach us through the Medigap inquiries or through the training inquiries so that we can get the details and get back with a response. Because in some cases, I do believe that person would have guaranteed issuance rights, and in other cases, they would not. It's a very case-specific question.
Nope, to understand that. So I will, and we'll be putting our training mailbox address in the chat. So that way, this person, you can go ahead and send us this message so we can make sure we get back to you directly. Okay, so the next question. Let's see, we have more had just come in. Okay. If someone started Medicare with an MA plan and wants to switch to Medigap within the 12 months, which is their trial right, however, they were disenrolled from Part B for 5 months of the year, will this person be able to buy a Medigap with a guaranteed issue?
So I'm going to try to give it back to you. So it sounds like someone at age 65, presumably, purchased Part A and Part B, failed to pay their Part B premium, and they were disenrolled from the Medicare Advantage plan as a result of that. And then some period afterwards wants to go back to Original Medicare. So there are a couple of things happening here. In order to get a Medigap policy, you have to have Part A and Part B. If such an individual has what we call a special election period to enroll in Part B during that time, they'd be able to pick Part B back up, pay back the late enrollment, pay back any late fees or late associated with Part B. If they can get Part B, then they can go back to Original Medicare because it's necessary to have Part B in order to get Medigap. So if they lost Part B and they don't have an open a period to pick up Part B, then they're out. But if they have an election period to pick up Part B due to extenuating circumstances or whatever, they can pick up the Part B, and if they're still within the 12 months, they should be able to get their EI rights into the Original Medicare to go along with their Original Medicare.
Thank you. Okay, so I'm moving to some of the questions that were asked a little bit earlier on in the webinar. This one is asking if a provider who accepts can a provider who accepts Medicare refuse to work with a Medigap plan?
So the only requirement to pay, this question, it could depend on what they're saying. Are they saying they don't want to reimburse the individual themselves, or the Medigap plan has to pay the person for the 20% coinsurance or the copay or the deductible? So some of it is in it. I don't know if this question is more on the administrative part respective to how the person gets reimbursed. Like, for instance, an individual can come to a provider and the provider can say, we're not coordinating with Medicare. You have to pay your coinsurance and any associated deductible with this care, and your Medigap policy will pick up and reimburse you. That's one of the nuances that I get with this question, and that's the way and the question could be asked specifically that way. The Medigap policy, however, whatever in the evidence of coverage that explains how they pay providers, that is how that particular situation is handled. The Medigap provider could say, the Medigap issuer could say, we're only paying the provider, you'll have to get your money back from the provider. Or they could say, you must submit the claim after your provider does it, and then we'll reimburse you. But the only thing that's required for a Medigap company to pay is notification that Medicare has paid. It's a process that's called the Coordination of Benefits Administration. And when Medicare pays, they notify the Medigap carrier that they have paid and approved. There's a Medicare approved service that Medicare has paid, and now, in accordance with your contract, Medigap carrier, reimburse this beneficiary or reimburse the provider. So often it's not so much whether or not the provider will accept it, because the person or the entity that's paying is the Medigap insurance carrier, not the provider. I hope that's helpful. It's a little bit of a confusing situation.
And I encourage anyone, if you've asked a question and we're answering it, but you still need a little bit more clarification, you can always still, send us that email to our email box, or training@cms.hhs.gov, which we put in the chat, and we'll be happy to get even further clarification if needed. Okay, moving on to another question. Can the insurance companies offer additional benefits in addition to the basic benefits?
There are limited benefits that insurance companies can offer beyond the standardized benefits in a plan that's listed through Plan A through N. There's a lot of history behind this. I'll just try to simplify it. Plans are standardized, Plan A, Plan C, Plan F, and D, G, M, N, K, and L, to prevent confusion in the Medigap market. There are many seniors who are buying multiple plans decades ago because there was so much confusion respective to what each plan covered. That's why, as we emphasize in this presentation, a Plan A from Blue Cross and Blue Shield is the same as the Plan A from Aetna, Humana. Those basic insurance coverages are included in all the plans, which is why we encourage individuals to look at pricing, because pricing is the key factor. Plans can, however, offer what's called an innovative benefit. And that benefit cannot otherwise be offered or available through Medicare or through the plan. And usually it's something, in most cases, something like a membership into a gym, or maybe a light coverage of vision, maybe a free pair of frames or glasses or something like that. But it's not usually something like, oh my gosh, we're providing, it certainly wouldn't be drug benefit because that's illegal. But it's usually a nominal additional benefit that may inspire someone or push them when they're picking between two insurance carriers an additional little push that kind of tickles that person's need. So those benefits are called innovative benefits. Plans can also offer something like I mentioned before, like vendor discounts. So maybe a discount to your local gym or fitness center, things like that. So there are some additional benefits that can be offered, but those additional benefits are monitored very closely by the state and have to be approved by the state before an innovative benefit or a vendor discount can be added to Plan A, because again, the whole idea is not to marginalize the standardization of all of the plans.
It's a very good explanation. I follow in that and appreciate that. Okay, could you just summarize briefly, how are the out-of-pocket limit amounts arrived at?
Every year we get information from that's derived from the Consumer Price Index, and the actuaries for HHS calculate based upon the average consumer price index for urban dwellers across the country, how that should impact the rates that insurers will provide. CMS, Office of the Actuary, actually does that calculation, and we submit on an annual basis in September, usually around September, what that rate will be. And then insurance companies use that rate to reflect the increases for the subsequent year. So typically the rate announcements go out in September or early October. Insurance companies then apply that rate to the policies, and then that rate is applied to the subsequent year at the beginning of the calendar year, beginning January 1 of the following year.
Thank you. Next question. What is hybrid Medigap? I'm not sure I've heard that term, but I'll let you take that one.
I have not really heard of hybrid Medigap. I will say that there are a number of insurers that may try to sell something and use the term Medigap in that policy. One of the protections that was included to stabilize the market and protect consumers is that to the extent anyone is putting out an insurance policy that supplements Medicare, if it is a federally standardized Medigap policy, in the binder and in the evidence of coverage that the insurance company sells, it will be called Medicare Health Insurance Medicare Supplemental Health Insurance. If it does not say that, it is not a standardized Medigap policy, and it is not subject to all of these rules. In other words, guaranteed issuance, guaranteed renewability, all the trial rights and everything that we've discussed. It will not include those protections. So we urge individuals to look at the policy binder, the evidence of coverage, to certify that it is in fact a Medicare supplemental health insurance policy, because it could just in fact be one of these rogue policies where someone is offering to take $300 from you every month and then not cover any of these benefits. It's very important that when you look at the evidence of coverage that you are seeing the standardized chart that my colleague Marie showed earlier, where she outlined all of the coverages that a standardized Part A plan would cover, a Part C plan, a Part F, a Part G, L, M, N, K. Those specific benefits should be outlined, and it should be called Medicare Supplemental Health Insurance. Otherwise, it is not covered or subject to the provisions that the states must follow to protect the beneficiaries.
Question. This person's asking, they're asking, what happens if you have, since Medigap policies are regulated by state and also federal is what she's stating. What she wants to know, what is one's recourse if there's a policy issue? What does she do?
So the Secretary of HHS has established, through the authority granted by Congress, the procedure to enforce and oversee Medigap policies. And it's been done through the National Association of Insurance Commissioners. So HHS, myself and Marie, we have, well, historically, we're the subject matter experts now. We have worked along with the National Association of Insurance Commissioners to establish a model regulation that governs Medigap policies. It includes all of the federal requirements that we talked about in this presentation. States are required to adopt the provisions of that model regulation. And once they do, generally speaking, we, the federal government, step back and we say, state, as long as you stay within the provisions of this model regulation, this is for you to enforce and oversee all issuers and all beneficiary complaints, as long as you're enforcing it consistent with the provisions in this model regulation. If there's a situation where a beneficiary, for instance, feels that they are not getting the correct answer from their state, they've looked at federal law and it seems that the state is not supporting the federal law, that's when we step in on behalf of the secretary and bring the state into question about, what are you doing here? Why are you not enforcing the provisions? I've been doing this for about 15 years. I've never really had a situation when that happens. The states generally do a very good job of enforcing the provisions in the federal statutes and work very well in coordination with the NAIC to make sure that there's consistency in the application of the principles. So that was a long explanation to kind of give you the history. But if there's an issue, the first course of action is the State Department of Insurance.
I appreciate that background myself. Thank you, Derek. Next question, if you move to a waiver state, do you need to switch to a waiver plan?
Typically what happens is if an individual moves from one state to another, not even necessarily a waiver state, that insurer will require them to keep their address information, so forth and so on, current. So if someone moves from a non-waiver state to a waiver state, when they make that move, there are already premium differentials and rate adjustments that will occur because just to move from one state to another state, there are different risks associated with being insured. So yes, that person, it's likely that their insurance company will, when they notify them of the move, if they become aware of the move, they will require them to pick up an insurance, a Medigap policy that is in the area or state that they are currently living in.
Thank you. Next question, if you have a plan that is community rated in terms of premium cost, does the premium change if you were to relocate to a different area or state?
In general, I think that the rate would be subject to change. I mean, the rate to insure someone in New York City as opposed to someone in the hills of Montana, there are different risks. And the insurance companies in those states can sometimes offer more competitive rates because the risks are less, or they may have to offer rates that are more expensive because the rates are larger. So the risks are more imminent. So in either case, whether it goes up or down, it's the move that triggers the need for a rate change. And each insurer in the policy binder will explain the rules for notifying the insurance company and how to navigate to, or the time frames for navigation to another policy. That's more of a specific requirement that the insurance companies have in the binders and evidence coverage materials.
rules govern non-waiver states offering optional benefits? And this person lives in Tennessee, and they're saying like they have a Medigap that offers a fitness benefit. So just kind of interested in that in the ruling there.
I'm not sure I heard the question.
It's
You're saying
what
they're in a
rules-
plan that has a fitness center benefit?
No, like she wants to know what rules govern non-waiver states to be able to offer optional benefits.
The same provisions that apply to non-waivered states govern the waivered states. Innovative benefits and vendor discounts are applicable, and the provisions for those, which are in the federal statute, are applicable to both waivered and non-waivered states.
Moving on to another question. So this person's question is, if you miss your OEP, I know that one's the same one we already did. I'm sorry about that. Didn't mark that one. Okay. Does guaranteed issue mean a person does not have to go through underwriting?
It does, yes.
Right. If you turn 65 before 2020, if you turned 65 before 2020, you can buy Medigap Plan C or F. Is this correct?
That is correct, yes.
Okay, here's another one about guaranteed issue, I believe. What if someone first picks up Part B, maybe they're older than 65, like 69 years old, and they join an Advantage plan when they join Medicare at age 69, do they have a trial right to pick up a Medigap with guaranteed issue rights? And I think we had a similar question to that effect, but sounds like there's some confusion there.
I wasn't clear on the age. Did you say 59, like 5'9"?
I'm sorry,
and then
69, sorry, 69. So they're older. They didn't get Part B till they were 69, past the age 65 eligibility age.
So insofar, if the question is about guaranteed issuance rights, the Medigap OEP, it's very important to remember that it is not triggered until that individual is both 65 years of age or older and has enrolled in Part B. So we have coordinating special enrollment periods for people to enroll in Part B far after the age of 65, and it's called the Working Aged SEP. And what it means is that you were able to delay the purchase of your Part B without the 10% Part B premium that would typically be applied to you. I'm sorry, the 10% Part B late enrollment penalty, which happens for every 12 months that you could have had Part B and didn't get it. So in other words, for 65 years of age, you don't enroll in and you get your Medicare Part A. If you do not enroll in Part B and you don't have other creditable coverage, for every year that you don't have creditable coverage, an additional 10% on whatever the Part B premium is applied to your Part B premium. If, however, you're still working, and that's the reason you elect not to get Part B, we have what's called a working age special enrollment period that will allow someone who is 69 or 75 or however late it is that they decided to work to enroll into Part B without the 10% penalty for every year that would have otherwise occurred for every year after they were age 65. Along with that special enrollment period that eliminates the Part B LEP, that you call the late enrollment period, is a coordinating OEP. And again, that OEP is the Medigap OEP. So again, you have your Part A. You did not have Part B, but you were 65. So that OEP is triggered, the Medigap OEP is triggered as soon as you get Part B. And in the case of the example that you just raised, I think the person is saying that, oh, they decided to get Part B when they were 69. If they had employer-based coverage, they'll get their Part B without penalty, and simultaneously, the OEP for Medigap will trigger the first of the month. For the first month, they get Part B, and it'll last for 6 months, the federal OEP. And that means they will have guaranteed issuance into Medigap without underwriting.
Great. The next question is, who determines if the loss of a hospital from a Medicare Advantage network is significant enough for it to qualify as a special enrollment period?
So this really isn't a Medigap question, but I can tell you that CMS makes the determinations about significant provider network changes. It is not the state, it is a CMS function. And when CMS makes that determination, if in fact it is determined that a significant provider network change has occurred, guaranteed issuance rights will typically follow that determination.
Let's see. If an individual is under a spouse's plan and does not take advantage of going into Medigap at age 65, can they take advantage later? Can they do it later? And I think we just kind of talked about that a little bit, but sounds like, and I'm seeing some questions in there that, you know, again, are a little bit about like timing of can they do it later, depending on the different situations that, you know, they may be in. So if you could maybe just clarify one more time about the timing of going into or getting a Medigap.
I think in the question you said an individual, let's say a spouse, is under their spouse's coverage, presumably employer group health plan coverage. That person has, and they're not in Part B, but they are 65. If they're covered by that employer coverage or union coverage, and for that reason they have not enrolled in Part B, the SEP for working aged individuals would apply to them because they have employer-based coverage. It's a creditable coverage that stands in the place of Part B until they get Part B. Then when they purchase Part D, because they're over the age of 65, it'll trigger the Medigap OEP, and then they're able to have the issuance of a policy with guaranteed issuance rights.
Sense. All right. Okay. If you leave Medigap for a Medicare Advantage plan and return under 12-month trial right to your prior Medigap plan, are there any guarantees you will get your Medigap plan back at the same price you would be paying if you had never left the plan?
Yes, that's what the provision is. The provision does cover, that's the purpose of guaranteed issuance, so that you're not subject to rate increases. It's not like you're going to leave and you're paying $200 a month for your Medigap policy and then come back, okay, we're letting you in the door, but now we're charging you $500 for the same policy. No, that's not going to happen. However, it will be subject to the regular rate increases. For instance, if someone were to leave over the period, like for instance, if they left in the middle of a year and then there was a rate increase that everyone was subject to, that person would be subject to the same general rate increases that everyone else, as we talked about in the presentation, would be subject to for inflation or other factors.
All right, for just a couple more questions before we wrap things up. Could you repeat one more time? There's still a few questions in here about our policy, Medigap policies, state or federal approved? Maybe just the difference between or how Medigap plans are approved.
So all policies are approved at the state level. Insurance companies apply with their state departments of insurance, and they get approval to sell. For instance, Plan X goes to their state department of insurance and says, we want to sell plans A, C, M, and N. The state department of insurance will review the application, make sure that it's consistent with all the provisions that are required in the NAIC model regulation, which has been promulgated under the auspices of the federal government. And the state will approve that carrier to sell those policies in that state. The state will also oversee any issues related to the sale of that policy, any complaints from beneficiaries who purchased one of those policies. The state serves as the primary enforcement and oversight entity for all Medigap policies, including sales, including disciplining agents for perhaps fraudulent activity or whatever. The state is the first line of action or the first course of action for carriers to go to for clarifications on the provisions, and also for beneficiaries to file complaints regarding an issuer in that state.
Thank you. Let's go ahead and take our last question here. Actually, there's two more, but they're somewhat related, and they pertain to if you're in one state and you move to another state, what happens? And so they're asking, can they require you to enroll in a Medigap plan that they sell in the area where you move and make you leave your current plan? Or the same goes to the other question related. It's just about moving and can you keep the plan?
Yes, they can. To answer the first question, I think I understood an insurance company can require you to move to another plan. Now, we do have Medigap companies that sell in all states. There are some Medigap issuers who sell in all of the states. So once they become aware that you have moved, even if you don't disclose it, they'll find out because your care is being provided by a provider that's in another region. They can, yes, require you to move to, perhaps if it was Blue Cross and Blue Shield in Montana, they'll say, okay, now you're moving to Blue Cross and Blue Shield in Maryland. There could be slight differences in the rate, but you would have to comply with that insurer's requirements to drop the plan and pick up another one. If that particular carrier does not have insurance, like coverage, for instance, if you had in that same example, a Blue Cross and Blue Shield plan F in Montana, and then you move to Maryland and they say, well, we don't have a plan F here. They could require you to pick up your plan F with another carrier. And you would work through all of that with your state department of insurance. And also you can get assistance with your state health insurance assistance program.
Thank you so much, Derek. I know that that's a lot of questions that we've been answering, or you've been answering, I've been asking. But there are, some questions still in the Q&A box that we're attempting to get to, but some of them, and a lot of them, we're going to ask you if those questions weren't answered, because I see some of them, it looks like they were asked earlier on in the presentation, and they may have been, may have been answered throughout the course of the presentation. So if you still don't have an answer to your question, we want to get that answered, but we're going to ask you to please send your question to our training mailbox, and that is training@cms.hhs.gov, and we will put that up into the chat right now. And you can just send that to us, and we'll be working through those and getting you a response. So we appreciate your patience with that. There's just so many questions, and we're out of time. So I would like to go ahead and take us to our closing. And I really want to thank Marie and Derek for such a wonderful presentation. I know it's a lot of information in this amount of time, so it's a lot to take in. But you do have, obviously the slides to refer to. But I really want to thank them, and I want to thank them for helping respond to the questions. You can download these slides as a reminder from our website in the same place where you launched the course. And you can visit our webpage in the future for a recording of this event. So don't forget to do that so you can listen to it again if you need to hear some pieces over again. You can also download your certificate for this session in the same place where you download the materials. You may have to wait a couple minutes after the event ends and might have to refresh your screen to enable that link to get that certificate. Also, remember you're going to get an email evaluation for today's session. So we encourage you to respond to that, and it really helps us to make those continuous improvements to our national training program events and workshops. And finally, I know we've said it a number of times, but you can email us at training@cms.hhs.gov. That's on your screen, along with our website. So remember, that's where we have all these wonderful training materials. So please take a look at that as well. Again, thank you everyone who attended, and thanks to all of you who have attended, not just today, but all of our virtual workshops over the past 2 weeks. We are looking forward to receiving your evaluations so that we can start planning the workshops for 2025. So have a great day, everyone.